Good morning, everyone. Today here I am here to present a primary bony lesion of an orbit. So the patient was a 28-year-old female patient, homemaker, presented with a gradually progressive swelling over the left brow area since 9 months, and it was causing mild drooping of the eyelid. More than drooping, the patient was concerned about cosmesis, and patient was worried in future the eyes might get affected. So she presented to us, and medical, family, psychosocial history was unremarkable, and there was no intervention done in the past for the same, and there was no recurrence of the disease before. And clinical findings, apart from swelling, patient had mild mechanical ptosis like grade 1, and her visual acuity was normal. Her ocular examination, systemic examination, including extraocular movements, everything was normal, and there was no proptosis or anything or enophthalmos. It comes when to describe the swelling, it was a well circumscribed swelling. It was hard, 1/2 centimeter, non-mobile, and it was adherent to the underlying bone. It under the overlying skin was normal. It was not adherent to the skin, and underlying conjunctiva was also not free. There was not even a congestion or a mild redness in the conjunctiva, and we couldn't insinuate the fingers in between the bone and the mass. So we did imaging. This was the CT brain on the orbit of the patient. So it showed a expansile lesion arising from the periorbital region of the left orbital superior margin, and it was seen extending till the orbital roof, but it was not entering anywhere. So inside the medullary cavity is normal, and the extracorneal and intracorneal compartments are normal. Intracranial compartment also, there was no invasion. So we can see in various views, axial view, sagittal view, and the coronal view. So this was the 3D construction of the same, showing a clear-cut swelling. It was giving a very good idea of to know before surgery, to plan the surgery. We can see the supraorbital vessels were well far away from the swelling, and this was the MRI of the same person, and we could see hypointense lesion in the T2 images, and blood reports, everything else was fine. So we were differential diagnosis. We thought of many lesions, either benign lesion or malignant lesion, and obviously fibro-osseous lesions were also thought of, because it was very slow growing over a period of 9 months. Management, we counseled the patient regarding the possible diagnosis, the complication during surgery, and our option was only surgical management of the that is excision of the tumor, and taking for biopsy. So patient was taken under general anesthesia with all precautions, like we had kept the blood and other things ready. Incision was taken 1 centimeter above the supraorbital margin, and the orbicularis oculi muscle was separated. We exposed the bone, the periosteum, and the supraorbital vessels were also separated, and this was the mass. It was very fragile, and it finally after the removal of the mass, good hemostasis was achieved, and then subcuticular sutures were put. So this was the post-op picture with edema of the upper eyelid. So in the histopath report, diagnosis came as ossifying fibroma, and this was the higher magnification hematoxylin and eosin stain. It showed areas of calcification, the fibrous tissue, and the myxoid tissue. In follow-up over 9 months, 1 year, patient is doing fine. There was no recurrence. So we thought of many diagnoses, and after this thing we came to ossifying fibroma, and patient didn't undergo any chemo or radiotherapy after that. So basically these are general slow growing benign tumors. It's a rare case, and usually have a good prognosis. It will have a good prognosis. Uh, Thank you.
Okay, nice case. I wanted to know, did you check for the ocular movements?
Yes, ma'am. It's
But
normal.
we don't have any pictures of that, right? I think, yeah. So that is also important, you know, when in a case we have you to show the different ocular movements. And what about when you said there was mild ptosis in the beginning, and was the ptosis totally relieved after the patient was
Yes,
operated?
ma'am. I showed the picture of.
Again, in that picture, since the patient is not looking in the primary gaze,
Actually, the
this-
patient has sent the photo. We didn't. The
no,
receipt.
that doesn't work. So
Yes.
because the patient is not looking in the primary gaze, so we cannot make out if the ptosis is relieved or not relieved. That way. Okay. Thank you.
Thank you.
What is the incidence of this lesion? How rare, how common or how rare is it?
Actually, it is common in other bones, ma'am. But for the frontal or orbital bones, it is very rare. Probably 20, 30, 35 cases have been reported worldwide.
So when you started off, you were saying it's intraosseous hemangioma in your previous.
Yeah, ma'am. That
why?
radiologically they gave diagnosis as intraosseous hemangioma.
Okay.